Hello, Dr. Kalisha. I just wanted to take some time to first thank everyone for engaging with my content. I hope I am answering questions and sharing topics that are interesting. Today, I wanted to share probably one of the most beautiful but controversial things that I do in my work, and that has to do around medication management for someone living with dementia. Our brains are beautiful, amazing, wonderful things, especially when they don't have a diagnosis of dementia. When someone does have this diagnosis of dementia, it can complicate our thinking, change our thinking, and totally change the person that we are most used to engaging with. And so because of that, often we see a lot of psychosis, and psychosis just means typically delusions and hallucinations. So delusions are when people have these fixed beliefs. Someone is stealing from them, someone is trying to harm them. There are these beliefs that it doesn't matter what you say, you cannot get them to think differently. Hallucinations are usually auditory hallucinations, so you're hearing something that no one else is hearing, or visual hallucinations where someone is seeing something no one else is seeing. There is tactile, where people can feel things on their skin that no one else is feeling. And so in these moments when people are dealing with these very distressing beliefs, very distressing feelings, antipsychotics are often the medications of choice. They are not FDA approved. We are definitely using them off label. But in these moments, I have seen at the right dose, at the right time, with the right family, just really everything aligning, and people telling me, thank you, Kalisha, I got my mom back, I got my dad back. And that person living with dementia being able to now differentiate between what is real and what is not, and having this quality of life that they wouldn't have had. I know it's controversial. I know there are a lot of concerns with many of the medications we prescribe. And so the first thing is just making sure you have someone you trust. Is this a healthcare provider, a primary care provider that will listen to you? I often tell my clients, my ego can handle you coming in here and saying that medication was trash, we didn't like it, let's try something else. Step number one, that's the first thing. Like, you have to be able to have this open conversation and dialogue. And then as the provider, I have to be able to tell these families, in X amount of days, in a week, this is what we should see. These are the side effects. This is what we're worried about. Yes, there is what we call a black box warning on these medications, and explaining what that is to them. So again, there needs to be this open conversation between everyone involved, because again, at the right dose, sometimes these medications can truly be life-changing for the person living with dementia and the family supporting them. Thank you for your time. If you're in this situation, please reach out if you have questions, want to get a strategy of how to talk to your primary care provider about it, or want to maybe find a different healthcare provider. It's challenging. It really is. Takes the right working relationship between family, patient, provider. Happy to help any way I can. Thank you, and have a great day.